And a good rainy Monday afternoon to everyone. Welcome to the latest coronavirus briefing. Mayor Jerry L. Demings will be speaking today along with Dr. Raul Pino, Orange County Health Officer for the Florida Department of Health, and Pam Neighbors, the CEO of CareerSource Central Florida. Topics today will include more clarification on the Phase 3 reopening, the latest COVID-19 numbers for our county, coronavirus hotspots, and job placement and retraining programs that are available for dislocated workers. Also here in the audience today is Scott Howitt. He is the Chief Communications Officer for Orange County Public Schools, and Graciela Noriega Jacoby, the COO of the Heart of Florida United Way. And now Mayor Demings.
Good afternoon. Thank you all for rowing here today through the water and the flood that's happening outside. But in all honesty, I know that we're still within our hurricane season, and there's still another month or so to go, a couple of months, I guess, before the end of that season. So we likely will be continuing to deal with weather phenomena here within our community. What I'm going to do today is, right from the very beginning, I want to address the executive order and the announcement that Governor DeSantis made last Friday. Since that period of time, my office has received numerous calls asking us to clarify the governor's announcement, and I'm going to hope to try to do that today. I have a few things just to say about the announcement itself. First, I want to remind everyone that the governor's order does not affect Orange County's executive order mandating facial coverings. We do not impose fines, and therefore the governor's reference to removing fines by local governments that require facial coverings does not affect us here within Orange County. What that means is that the facial covering order still is in effect here within Orange County. I want to remind our community that our nation, state, and county remain under states of emergency due to the public health crisis before us. But make no mistake about it, we are still in the midst of a dangerous pandemic. Florida has had over 700,000 cases of COVID-19, and over 14,000 residents have died as a result of the virus. I'll go over Orange County's numbers in just a few moments, but I want to make certain that there's no confusion about what the order says or does not say. I want to share with you just some personal experiences. Over the weekend, I had the opportunity to visit several different restaurants and several other major outlets. And all of the restaurant managers or owners I encountered wanted to do the right thing in protecting their patrons or their customers and their employees. They want the public to feel confident and safe patronizing their businesses. So I want to stress to business owners that they can and should still require the wearing of masks. We want businesses to fully reopen safely, and masks are part of this process. Based on these incidents, I believe our business compliance strike teams are more relevant now than ever. We're going to be proactive with our teams. Our goal is to make sure that they work with businesses so they can be successful and patrons can be confident they are visiting a business that takes its health and safety protocols seriously. We will continue to work with businesses in following the mask mandate, and we will be prepared to assist them with any needed personal protective equipment and signage. I want to alert businesses that they may want to check their insurance policies and make sure they are covered through a coronavirus super spreader or outbreak, or should a coronavirus or super spreader outbreak occur in their establishments. There are liability issues that should be considered. Now the state government really has abdicated all responsibility. I urge everyone to continue to do the right thing, however. Laws or executive state orders do not necessarily need to be in place by the state to do what is inherently right and good for our neighbors. It's simple. Take precautions, protect our most vulnerable and your friends and family. We all depend on each other to keep our numbers low. I want to talk about my goals for the week. I do that each week. We will continue our strike teams to assist businesses with any guidance, questions, and safety protocols. We will be as transparent as possible with coronavirus numbers and where the outbreaks are occurring. We depend on the Department of Health to provide the data to us. We will continue to offer free testing to any Orange County resident who wants it. Since the beginning of the pandemic, Orange County has had a total of 39,990 reported COVID-19 cases. That is an increase of 273 cases since last Friday when we provided the last update. We've had 443 residents who have died of the coronavirus. Since we last met on Friday, we're fortunate here in Orange County, there were no new reported death cases associated with the virus. But we do want to always recognize the pain and suffering of families of those who are going through the ordeal and who have lost loved ones. Our 2-week average is 4.2%. Remember, this is for the last 14-day cycle. Our average since the beginning of the pandemic in March is 11.4%. This past Saturday, our health services provided free testing to 145 people at the Caribbean Health Fair at Barnett Park. This Wednesday and Thursday, Orange County Health Services will offer free COVID-19 testing to those in East Orange County near Bithlow, Wedgefield, and the Christmas areas. The team will be at the East Orange District Park located on East Colonial Drive in Christmas between the hours of 8 a.m. and 1 p.m. again on Wednesday and Thursday of this week. Appointments are encouraged, but walk-ups are also welcome. Everyone will get mask and hand sanitizer who participates. You can get information by visiting our website at ocfl.net/eastorange, or you can go to our website at ocfl.net/testing for additional information about future testing. Since the beginning of the pandemic, Orange County has given away more than 12 million face masks to our residents and 3 million bottles of hand sanitizer to small businesses and community-based organizations. With the mask order still in place, we ask that you please continue by CDC guidelines to avoid the spread of the virus. Since March, many Orange County-based nonprofit organizations have had unanticipated expenses as a result of the COVID-19 pandemic. Nonprofit organizations have seen an increase in services may need to make application for our Orange County Cares for Social Service nonprofit funds. We have $2.8 million in funding available through the county's social service nonprofit fund program. Reimbursement up to $5,000 is available for expenses that include personal protective equipment, computer equipment and software, cell phones, and cell phone service. Through our contractual agreement with the Heart of Florida United Way, disbursements and applications will be made October 19th, again for the Social Service Nonprofit Fund. The United Way is a trusted fiscal agent and community collaborator that has long-standing relationships with many nonprofits in our community. You heard Ms. Wattrell mention earlier that we do have Ms. Noriega Jacoby, who is here, who will be able to answer any questions. She's in the front, and if you have any questions about how that process will occur, we brought her here today. For more information, if you're a nonprofit business, you can go to ocflcares.org, or you can go to OCCcares at hfuw.org. That's OCCares at hfuw.org. And finally, we have $36 million in federal COVID-19 aid that has been set aside for social service agencies and nonprofits in our community. The goal is to provide food, job training programs for people facing homelessness, mental health crises, addiction, and child care dilemmas because of the virus. We have allotted $9 million alone to help with job placement and retraining. Here today is CareerSource CEO Pam Neighbors, who will discuss a $7 million program that is funded also through the Orange Cares Act dollars. She is here, and Ms. Neighbors is down front, and she will speak after Dr. Pino. So I'm going to transition to Dr. Pino, and then we'll have Ms. Neighbors come up and talk to you about those dollars. Dr. Pino.
Good afternoon, everyone. The county continued to perform well data-wise, and the numbers are quite low at this point. Although I always said that Monday is not a good day to set a trend. It's just a day. The trend comes later during the week. But we continue to have a 96 positive recovery rate. That is 96%. And I want to give people a few alerts after I give you the numbers. The first one is that we received yesterday 34 positive tests. But again, it was a Sunday. That is a total out of, also we received 105 negative tests, and that gave us a 4.0 positivity rate. But within that data, we also are observing an increase of flu activity in the ERs continues. And this is the time for people to vaccinate against the flu. If there is a year to be vaccinated, this is the year to be vaccinated for the flu. This winter could be a harsh winter health-wise. The mayor mentioned to you that Orange has 39,990 positive cases cumulative, and we have no additional death since we spoke to you last. We also want to alert people about super spread events. That is congregation of more than 10 people without proper measures in place, and then the contamination of multiple people from a single source. We are not 100% sure, but we are looking to our data. We think that we have detected a couple of events, super spread event in the last week, and as soon as we have all the tracking information in place, we will display the data for you. But we thought that was important, even before we get to the data, maybe next Thursday, to alert people that this is happening. It is important when you are hosting individuals at your house, your church, your community center, to continue to have those measures in place, more so if the event is held out indoors. So wash your hands, wear your mask, keep your distance, and keep protecting people who are vulnerable and have pre-existing conditions. We also have detected a few instances, again, where the child is bringing the virus into a home and infected parents and grandparents, not necessarily acquired at schools, but when I say child, it's any age. And this is also happening. But in the midst of that, week 39, which was last week, we have a negative growth of 29%. That is the highest since week 32, the highest decrease that we have. And we also are our lowest point on incidence rate per 100,000 in the last 14 weeks. Now, but we also have, as I mentioned to you, continue to see a slow increase in the 14-day rolling average data. Now, this data doesn't include the testing that is done at the bubble in Disney for the NBA. So it's a little bit different. It's a data that we watch closely for our own consumption, but it gives us a better measure of just our residents. That is a small increase. It's not significant, but it's something that we have to look for. I don't have any additional data, but not because we are performing so well, not because the data is going all in the right direction, we should relax and rest in our laurels. This pandemic has proven before that it can come back and come back with vengeance. With that, Mayor.
Thank you, Mayor, very much for the opportunity to come and talk this afternoon about Orange County Help Is Here. As we know, our Orange County has been very hard hit by the pandemic over this last 6 months. We continue to see a 16% unemployment rate, and that is very high. We're in the top 3 in Florida, and we know that we will continue to see layoff notices. But despite that, we are still seeing businesses hire in the manufacturing, particularly in the healthcare sector, in social assistance, in construction, and in professional services. And so it's very important that Orange County be able to provide services for job search assistance, for short-term skills training, and for paid internships. First of all, I want to say the number, but I know that it's also being shown on the screen, but you can reach the services and ask about Help Is Here at 1-800-757-4598 and press option 6. You also can go to our website, www.careersourcecentralflorida.com/helpishere, to get all of the information that I'm going to provide this afternoon. So first of all, what people need most is to understand how do they reposition themselves into the job market. We have dedicated professionals who are helping with career consultation, job search assistance, reviewing resumes, helping to redo resumes, and also referring individuals to those jobs that are open right now. We have jobs immediately. Right now, just today, we were looking for 25 businesses in the healthcare sector, the accommodation. A few accommodation jobs still are rehiring. We also see a lot of healthcare jobs and manufacturing and construction jobs still being out there and being actively recruited after. So a lot of job search assistance customized. Secondly, we have training resources. So we can put an individual into a training program to, say, get their Microsoft Office certification with our partner, the Urban League of. Or we can put them in micro-credentialing programs at Valencia College, at Seminole State College, at Orange Technical College to get things like project management certification, mechatronics, a medical office certification. And also with our nonprofit community-based organizational partners, we have some short-term training programs, again, that are offered through those training programs. And then most importantly and available right now are paid internships. So we have an opportunity for you to continue to work, gain a wage, and also fill that gap on your resume. We just this past week put 21 individuals, out of work performers, to work at Central Florida Community Arts, doing stage production, doing tutoring, doing classroom assistance, educational assistance. And we're so excited about programs like this that provide anywhere from $12 to $20 an hour for 8 weeks in healthcare, trade and logistics, construction, professional services, and manufacturing. So who is eligible for this program? You have to be impacted by COVID-19. You have to have either been a dislocated or laid off worker or furloughed worker who's looking for services. You have to be an Orange County resident. And so those are the things that our staff will look to help to document so that we can bring you into the program and enroll you. We have over 2,000 applications already, and we have many in the pending process, but we have 500 individuals who are already actively engaged in career counseling, training, and internship services. I'm very excited about this program. I don't want you to wait because this program is only available through December of 2020, and so it's so important that you reach out to CareerSource Central Florida right now. We have all kinds of different combinations of things that we can do. Either we can do services in person at our 2 Orange County Career Centers. One is in the East Orange County on Cimarron in the Airport Business Center. You can call for an appointment and meet with a career consultant there. Or all of the services that we provide are offered virtually through our website and through appointment and video conferencing ability. We also have another career center, brand new. We opened at the West Oaks Mall. It's right across from the Orange County Tax Collector site, so very easy to find. Again, all of the services that I've talked about are available in-person appointment or virtually through Zoom meetings, FaceTime meetings, and et cetera. Just today, we had 180 job postings open and looking for workers. So very important that you reach out to CareerSource Central Florida and connect with the Help Is Here Orange County CARES Act program right away. Thank you, Mayor.
All right. We'll open it up for questions at this time. Just as a reminder, we do have Mr. Scott Howard here from the school district, Ms. Noriega Jacoby, who is here from United Way, and then, of course, Ms. Pam Neighbors, who you just heard from CareerSource. Any of them can respond to questions. To our Spanish-speaking media, if you have questions in Spanish, certainly Dr. Pino is fluent, and if need be, I'll have my assistant, Ms. Ilia Torres, come forward to interpret for me. Okay. With that, we'll open it up.
All right. Lauren Seabrook, Channel 9. Mayor, this question's for you. I've spent the day talking to a lot of local business owners, local restaurant owners. Is that me? Sorry. And the consensus is that after this announcement came on Friday, many of them feel like they're kind of caught in a political fight of some sort. They feel like what's coming from the state and what's coming from the local leaders are different, and they feel like a lot of it has to do with politics. They don't really understand who has, sorry, is it mine? Okay. They don't really understand who has authority. Does that make sense?
I got the question.
Some of them are posting signs up that say you're no longer required to wear a mask in and things like that. I think for the most part, everyone wants to do the right thing. They just don't understand. Do they follow you or do they follow the state?
Well, in this case, the order that we put in place regarding the mandatory wearing of facial coverings in Orange County is still relevant. It's still the case here. In many ways, however, the state has decided that it would absolve itself of the responsibility for the response to the virus and left in place the ability of local governments to be able to respond. I'm sure you've read the order at this point, but it places the responsibility back to those local governments that if they do something contrary to the governor's executive order, and that is where he opened things back up to 100% capacity, but said that you should still consider social distancing, it creates some confusion there. What I'm saying here is that what we should not be confused about is the fact that we still do not have a vaccination for the COVID-19 virus, and that it is still alive and well in our community, which means that we have the responsibility, whether you're a business owner or an individual, to protect ourselves and stop the spread of the virus. So what I simply said to the business owners was that you do the right thing. Remember that there are CDC guidelines, and what I suggested a few moments ago was that there's still liability, exposure, risk, et cetera, and depending upon that business's insurance policies, if I visit your business and it is determined that you were negligent, that you didn't take some action that could have protected me and the spread of the virus while I'm there patronizing your business, perhaps you have exposed yourself to some liability. And for that, if I were a business owner, I would make certain that I continue to do those things to keep my customers, my patrons safe. That's all I'm saying here. And I think one of the things that businesses can do is mandate the wearing of facial coverings. They could still make the decision to socially distance their patrons. So if does the government need to tell you to do that in a public health crisis? I don't think so. I think that if you are listening to your patrons, we know that when we did the consumer confidence surveys here in Orange County, we know what the residents said to us they wanted to see. They want to see these sanitary protocols in place in those businesses. They want to see that the employees and the patrons are wearing masks. If it were me, if I go into a business knowing that the virus is still alive and well in our community, and I see a crowded place and nobody's wearing masks, I'm going to turn around and walk out. I'm not going to patronize that business. That's what I was hearing from the different business owners and restaurant managers, et cetera, who approached me when I was in patronizing these businesses over the weekend. That's what I heard them say to me. We're going to continue to do this because I want to make certain, we want to make certain that our business is safe for people to come in. Does that make sense to you?
Yes.
Okay.
Steve Hudak from the Orlando Sentinel. This is for, let me start with Dr. Pino, but it's also for you. Dr. Pino, you were talking about super spreaders, and I think, help me out with this. Are we talking about super spreaders infecting a lot of people, say, at a business or private gathering? Because one of the things I noticed over the weekend is that a lot of folks are just eager for things to get back to normal, and they want to be around family and friends, but that's a little dangerous, isn't it?
Yeah, those are super spread. I was referring to super spread events, and it is the event itself where you can connect place, space, and time, the infection of multiple people. In this case, probably one of them is more than 20. And the other one, I don't know the whole scope yet because that's the newest. But the idea is that in enclosure spaces, the transmission of the virus increase. And if you are not observing any of the guidance that was given before with regard to washing your hand, wear your mask, and watch your distance, you are going to create conditions that will favor the transmission of the virus. And that can be deadly. As we know, we have 443 people in our county have died. And we know that at some point, we all are going to go down that road. But many of those people didn't have to die. Many of those people were healthy individuals at a young age. We have 26, 21, 49, 39, 32. We have people who were 27 years old. So this pandemic is serious, and it's serious enough that it has killed 443 people in our county. So if that is not significant for anyone, you know, our community has events that have marked our life forever, where 1/10 of the number of people have died, that they died from the pandemic. Imagine how this pandemic is going to mark our community and the nation moving forward, when we have, could be, you know, a very high number of people who have passed away. Serious.
Megan Cruz from Channel 9. So after speaking with people in the community, it seems like there still is, you know, some confusion as to phase 3. Is it your understanding that phase 3 applies to just restaurants and only bars that have food service permits? Or are we talking about all restaurants, all bars, theme parks, all of the other businesses that were mentioned in the phase 3 plan that was unveiled earlier in the spring?
The governor has a very detailed plan, and within that phase 3 plan, it makes reference to all businesses, but certainly it specifically enumerates restaurants, bars, retail outlets, etc. And essentially what his order said was that they can return to 100%, but with social distancing in place. So that may be incongruent to say full capacity, but have social distancing in place. So that's what creates confusions. I know that the governor's office has said to some of my staff that they plan to produce some frequently asked questions and responses. I haven't seen it at this point, so perhaps when that comes out, it will provide further clarity. What I said on Friday and I'm saying today, when there's not adequate communication between the governor and the subdivisions of the state, the local governments, this is what happens. This is the result. It creates confusion when that 2.5-page document was silent on many issues. It was not clear because I did not issue the executive order. We have asked additional questions ourselves and have not gotten the full responses, just like the public. So what we're trying to do today is address that as best as we can with the understanding that we have.
Emily Brown with News 13. This question is for Mayor Demings. So how does the implementation of phase 3 here in Orange County affect the issuing of penalties for businesses for non-compliance? And does this take any authority or power away from the strike teams?
What we were doing with our strike teams, our compliance teams, were being proactive. We wanted businesses to reopen successfully and safely. That is still the goal for us. As businesses reopen, I believe that in many cases, if experts can visit your business and help share with you best practices, you should listen to that. Again, there's a potential for liability exposure there. And certainly if our strike teams go out and they tell you that what you're doing is inconsistent with best practices and you fail to make any adjustments, if it can be demonstrated that a particular outbreak occurred at your business, I think that you can potentially be liable for that. At this point, there's nothing at the federal level or at the state level that has removed the potential for a liability exposure. And so, in my opinion, the governor got out of the business of trying to impose sanctions or enforcement for whatever reason. And now local governments, you can, but you have to meet certain thresholds. That kind of punted the responsibility to those of us at the local level. We have to deal with our residents. All laws pretty much get implemented at the local level, and there are still some regulatory authority over many of the businesses that we have talked about that still have to meet all of those sanitary protocols. If you're a hair salon, barber salon, if you're a grocer, if you're a restaurant, they already have sanitary mandates in place that the health department can still regulate and still enforce at the state level. So there's no blanket waiver of all of the government oversight for various businesses to operate in a safe manner.
Chelsea Thorne with West 2 News. This question's for Dr. Pino. Dr. Pino, when can we expect to see either an increase or decrease in cases that we can tie back to this move into phase 3? And then also, how do you feel about the president coming to Seminole County on Friday? You know, those rallies are known for people not wearing masks. Are you worried that that potentially could be an issue?
The last question is good for Seminole County Health Director. He or she could answer that question. With regard to when we can see an increase, so this pandemic goes into every 2 weeks, 3 weeks kind of cycle. It is a little bit too early. And I don't think that moving to phase 3 is the issue. I think the issue, as the mayor was saying, is how can we move to phase 3 and continue to protect the public. And because as we have said before, we have to learn to live with the virus. But also to support what the mayor was saying, the executive order from the governor doesn't take away all the responsibilities that the health department has in fighting this pandemic. And we are guided by state laws that are in place, and we will continue to execute those and continue to execute the governor's order as our boss and state employee, but also at the same time protect the public. And I think we can balance both. Our numbers are low, very low, and that will give us room to be able to implement these increase in social activity. And again, as I said before, we are pleasantly surprised. The schools are a good example. How can we return to some level of normalcy and at the same time protect the public? It requires a lot of work, and people will not see and can't see what goes beyond the scenes, working with the board to try to keep the school in a healthy environment, and constantly in a revolving door, sending people to quarantine, acquiring people from quarantine, sending people to isolation. It's a lot of work. And you guys are going to have the opportunity to see that in action soon, as we have everything has been established. But say when we will see an increase. We have not seen it yet. I can tell you that much.
Buenas tardes, Félix Pirela de Telemundo. Quisiera saber, hacerles una pregunta tanto al doctor Pino como al alcalde Jerry Demings. Ahora que pasamos a la fase 13 de la Florida, ¿cuál es la principal preocupación de ustedes que ahora todos los negocios puedan funcionar al 100% de su capacidad, considerando que estamos en un área turística donde están los principales parques temáticos del país?
La misma pregunta para el alcalde? Sí. Oh, okay. So the question was, and it's the same question for the mayor, was what are the concerns that we have with phase 3 and the opening of all the theme parks and all the activity in our county? La respuesta, bueno, la gran preocupación va a continuar a ser el hecho de que las personas no tengan la falsa impresión de que la pandemia ha pasado. No ha pasado. Estamos en una buena fase, pero si nos descuidamos, nos da duro de nuevo y nos va a dar duro de nuevo si nos descuidamos. Tenemos que estar muy presentes y vigilantes. Pero también las personas que viven, los abuelos, la tía, las personas que tienen avanzada edad y que tienen condiciones de salud preexistentes, son las personas que nos preocupan más.
My concern is that by going through phase 3 without clear communication, it may suggest that things have returned to pre-COVID-19 conditions, and they have not.
La mayor preocupación del alcalde es que la fase 3, sin una comunicación clara, sugiere que las cosas han regresado a los niveles o a el estatus que teníamos antes de COVID, y eso no es correcto.
My concern is that if we become too complacent, we're going to see a third wave or surge in new cases in our community.
La preocupación adicional del alcalde es que si bajamos la guardia pudiéramos ver o experimentar un tercer brote o aumento en nuestros casos.
And I say that because today we do not have a vaccination or a cure for the virus, and the virus is still in our community.
Él lo dice o expresa su preocupación porque a la fecha no tenemos una vacuna ni una cura para el virus y el virus todavía se mantiene activo en nuestra comunidad.
And I don't want that for our community, I don't want it for my family, and I don't want it for me.
Él no quiere que eso suceda ni en su comunidad, ni en su familia, ni que suceda en su caso personal.
This next question was texted in from Ryan Lynch with the Orlando Business Journal. It's for you, Mayor Demings, or maybe Pam Neighbors would be able to chime in as well. He asked, how will the CARES funding for Career Source be used? If there's some specific examples that you can provide.
Sure. So the CARES Act funding is being used in 3 ways at Career Source Central Florida. It is being used for the career counselors, the additional career counselors, to reach out to 4,000 and enroll 4,000 Orange County residents into the CARES Act program to provide them resume consultations, job search referral, a lot of career counseling and identifying what is their career plan. Actually, they will be creating an individualized career plan with each of the enrollees. Secondly, the CARES Act funding is being used to support those training scholarships, either at our Valencia College partner, our Orange Technical College partners, Seminole State, also with small organizations that we work with in the past for computer skills training. So a lot of different kinds of training, very customized to the individual's need and what would make them more competitive in the market. And then thirdly, the CARES Act dollars are being used to support the internships, the paid internships of 8 weeks that I spoke about at either nonprofit organizations or even for businesses who are struggling to bring back all of their staff. One of the things that we found is that many businesses have brought back some of their staff, particularly small businesses, but can't afford to bring back all of their staff. And so this could bridge a gap for the next 8 weeks to bring those individuals back on under the internship program to continue to be engaged in work, build their skills, and be more competitive in the market.
Okay, if there are no other questions, thank you all for attending today. We will brief you later this week. Have a safe, blessed day.